Hi everyone. Today we are not going to talk about anti-aging or skin, but we are going to talk a little bit about the coronavirus, which is something that is affecting all of us in one way or the other. As you all know, the coronavirus enters the body through the eyes, the nose, or the mouth, mostly by touching our faces. Once it has entered our system, it tends to go to the back of the throat. Now, at the back of all our throats, there's two pipes that are there. One pipe is the esophagus, which takes food and fluids down into your stomach. The other pipe is called the trachea, which takes in air into your lungs. Now, what is important about the lungs is that when air has come and traveled down the trachea and into the lungs then take in oxygen from that air through its surface, and it spreads it to the rest of the body by going into the blood system. The blood, again, through the system of the veins, brings back the carbon dioxide, which your body no longer needs, back to the lungs, and it's excreted out of your body via the action of breathing out. Now, what happens with the coronavirus is that at the back of the throat, it mixes with the nasal fluids, and it flows and crawls down the trachea and into the lungs. And what it does here is it causes damage that is called fibrosis. Fibrosis is basically scarring of the lung tissue. Now, when the lung tissue or the lung surface is no longer viable as usual, it is no longer able to carry the oxygen from the air that you're breathing in into your system. Your whole body needs oxygen, from your brain right down to your toes. And it is also no longer able to take the carbon dioxide, which your body no longer needs, out of the system, because the tissue in the lungs is now fibrosed, or it is scarred by the coronavirus. Now, the second pipe that we find at the back of the throat is the esophagus, and this takes fluids and food down into your stomach. As you know, even if a grain of rice gets into the trachea by mistake and into your lungs, you will cough so much until that grain of rice is out, because the trachea and the lungs don't want anything except air. One of the good things is that the coronavirus does not survive in the stomach. In the stomach, there is gastric juices or stomach enzymes and acids that kill the virus, which is why one of the advice that is given is that you continually take sips of water, maybe every 15 minutes or so, because what happens when you are swallowing is that at the back of the throat there's an epiglottis, which is a structure that closes the top of the trachea, almost like a lid, so that when you swallow, it doesn't go into your trachea, but instead it gets washed down into the esophagus and down into your stomach, where it is not going to survive the stomach acids that kill it. One of the challenges that every country is having at the moment is the testing for the coronavirus. One of the simpler ways to do it at home, using a self-check method, is you hold your breath for 10 seconds or longer. If you can hold your breath for 10 seconds or longer without any problems, you probably don't have the virus. But if during that time you are struggling to hold your breath, and you are coughing, you are experiencing discomfort in your chest or tightness in your chest, it is possible that you might be having a little bit of the fibrosis already developing in the lungs, in which case I suggest you go and seek medical help immediately. Symptoms that you will experience with the coronavirus is, firstly, you might have a mild sore throat that will progressively get worse for about 3 to 4 days. Thereafter, because the virus, as I said, will then crawl down into the trachea and into the lungs, you will get pneumonia. And with the pneumonia comes the difficulty in breathing. That happens at about 5 to 6 days after the days of the sore throat. With the pneumonia also comes the high fever that is uncontrollable and difficult to manage. The nasal congestion that you get as part of the symptoms of the condition is not like a normal nasal congestion. You feel as if you are drowning in water because you're not able to get in oxygen and not able to excrete the carbon dioxide. Some important information for you to know. If a person has got a runny nose and are coughing up phlegm or sputum and it's productive, they most likely have a normal common cold. Pure coronavirus infection, a person will be coughing, but it will be dry and non-productive. Nothing will be coming out, and it will be associated with the symptoms of the pneumonia and the difficulty breathing, where you feel like you are drowning. The coronavirus itself is not heat resistant, so it dies at a temperature of about 26 degrees and upwards, which is one of my worry because our country is now approaching winter. We want to have this condition, this disease, halted before we hit our winter months. If a person sneezes and they happen to not sneeze into the fold of their elbow, or they do not sneeze into a tissue and immediately discards it, but they just sneeze, the saliva carrying the coronavirus can travel for about 3 meters to the next person that is sitting or standing around them. Once that virus lands on the ground, it is no longer airborne. So it is only airborne during the actual sneeze when it goes to the next person. Once it lands on a surface, it is no longer airborne. It can land on a table, it can land on a chair, it can land on a metal surface, anywhere. And on that surface, it can live for about 6 to 12 hours, which is quite a long time. Now, a person can come and just touch the table or touch that metal surface, and it is then transferred onto their hands. On our hands, the virus can live for 5 to 10 minutes. But during that 5 to 10 minutes, a lot can happen. We can rub our eyes, we can touch our noses, we can pick food and take it and put it in our mouths and eat. And this is how we then get infected, where the virus goes to the back of the throat, getting ready to go down our trachea and into the lungs. I cannot emphasize enough the importance of drinking water. Just warm water helps to heal most viruses anyway. But in this case, when you take sips of water every 15 minutes, that epiglottis, or the lid to the trachea at the back of our throat, will close the trachea and protect your lungs. The virus will be washed down into your esophagus and it will be killed by the stomach acids in your stomach. Please read carefully in our content below, where we've listed all the other important information that I'd like you to know. Myself and my team at Dr. P, we have decided to practice social distancing. We will be closed from today until the 1st of April. At that date and time, we will reassess the situation, what is happening in the country as well, and whether the conditions are conducive to us being open again. But we will let you know and we will keep you posted, because at the end of the day, your safety is important to us. We want you to be safe, and we want your families also to be safe. Please, as much as possible, try to practice the social distancing. If you have to be out in public, make sure that other people around you are about 3 meters away from you. Also, if you have to be in public, make sure that you have a mask on and you have your gloves on and you have a sanitizer on you at all times, where you can be able to wash your hands and use the sanitizer as well. I would like to thank the Minister of Health, Minister Zweli Mkhize, for all the tireless work that he is doing at the moment. In every country, it is very difficult to be facing a crisis like this one, because as you know, with Italy, there is no country that has enough ICU beds to be able to put people who are sick into the ventilator. A lot of the time, doctors have to make decisions as to which patient are they putting on the ventilator machine to help them breathe, and which patient to take off the ventilator machine because that patient is most likely not going to survive. It is not a nice decision to make. And I thank also the President, President Cyril Ramaphosa, for closing all the borders and trying to put this virus at bay from us. This fight is for all of us. It's not a fight for the government. It's not a fight for the nurses and doctors in hospitals. It is our fight. We need to come together. The triumph of this fight will be determined by the number of lives that we save. So please share this information with as many people as you can to save lives. Teach one life, save one life. Be safe, and we will see you soon.